Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Hospitals and doctors are ignoring RFK-JR's new vaccine schedule and relying on pediatricians' guidance instead. The Trump administration has unilaterally cut the number of recommended pediatric vaccines, removing shots for diseases like rotavirus, influenza, and hepatitis A. Major health systems and clinicians plan to ignore the new federal guidelines and instead follow the guidance from the American Academy of Pediatrics, which is similar to previous U.S. policy. This undermines the administration's effort to rebuild trust and underscores a growing divide between federal health authorities and major medical groups. The situation risks further balkanizing U.S. vaccine policy, where which vaccines a person is recommended depends on where they live or which doctor they see. Pediatric hospitals and other pediatric groups throughout the U.S. have stated they will be following the American Academy of Pediatrics guidance, not the new federal schedule. Doctors fear the changes will lead to an erosion of trust, even as research shows pediatricians hold the most sway in whether parents get their children vaccinated. States, which have the power to regulate which shots are required to attend public schools, could have the largest policy impact in the wake of the vaccine schedule change. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak